So we do applaud everyone making it possible. Many of us in the room tonight have had the privilege of sharing life's most intimate moments with our loved ones. We've witnessed the birth of a child, discussed health challenges of managing a chronic disease, or maybe been even fortunate enough to hold the hand of a patient or our loved one as they pass to a better place. I've been especially fortunate to have a front row seat watching technology transform healthcare. My career as a primary care physician and informaticist has given me the special opportunity to see how a simple idea like a secure email between a doctor and a patient can help coordinate a patient's recovery after a devastating stroke, or support patients trying to lose 20 pounds with the encouragement that we all need, especially after dinner like tonight, huh? It's amazing. Tonight we celebrate 5 award finalists who dared to defy conventional wisdom and dream to make the world a better place. These innovators use technology to develop solutions that provide answers to the healthcare challenges facing millions of individuals around the world. They cover the gambit of healthcare, from detecting disease and improving healthy behaviors, to developing procedures and applications that improve the health and outcomes for all of us. Caring for patients, regardless of their condition, environment, or social status, is the cornerstone of what our physicians, nurses, and caregivers do every day. And we practice humanity and empathy, and work hard to restore hope, often when it's nearly impossible to see someone's bright future. Each of tonight's finalists also deliver hope, and that's what we live for, hope. Hope for healing, hope for health, and hope for a better future. Collectively, they represent innovation at its best, a global focus that allows people to live better, healthier lives. On behalf of the more than 50,000 doctors, employees, volunteers, and innovators at Sutter Health, I'm honored to recognize the 5 finalists for this year's Sutter Health Award. Epopo came up with a unique and efficient system using African giant rats to identify the scent of tuberculosis in saliva. Mama developed a set of pregnancy and baby care messages that are sent to mothers to increase healthy outcomes. Nextleaf Analytics developed a low-cost remote monitoring system to record the temperature inside vaccine refrigerators and send SMS text alerts when necessary. Prepex is a non-surgical circumcision device that reduces HIV infection. And PulsePoint provides a mobile phone app for CPR-trained citizen responders to provide aid in cardiac emergencies. It's my pleasure to introduce the first Sutter Health Award laureate.
We were looking for a big problem that we could address with technology, data, and analytics. When we first heard about the problem of the vaccine cold chain and the need for vaccines to be stored at the right temperatures, we immediately became interested. Power outages and other problems cause refrigerators to get too hot or too cold, and vaccines die. In India, a recent study showed that 75% of freeze-sensitive vaccines showed evidence of being damaged. All over the world, the problem is vast, and often, despite vaccination, children are vulnerable to deadly diseases. We spent a lot of time listening to people who were really solving problems on the ground. And what we learned from that was cold chain sensor technology could actually provide a solution. So where do most good ideas start? In a garage. We pulled off-the-shelf components wherever we could. We used what was already built, and we put stuff together to get that very first prototype. Since then, we've been designing and improving Cold Trace for 3 years. This is Cold Trace. The components are really simple. There's a low-cost smartphone, a plastic box that we've manufactured in China, and a temperature probe. The probe sits in a fridge, and the device sends out text messages when the fridge starts to fail. The key innovation here is that the temperature probe connects to the phone over the headset jack. What this means is that our temperature probe is off the shelf and extremely cheap. It costs about $1, and has no battery, no electronic component. It's extremely simple to assemble, which means anyone can do it. The phone can record temperature data simply by playing a tone and recording a tone at the exact same time. And that's literally how the phone powers the sensor. Using our dashboard, health officials can view all of their vaccine cold chain equipment at one time. a Ministry of Health official is now able to ask, what has been the best performing fridge in my country, and how do we scale that up? A tremendous amount of resources and people and technology has to be marshaled in order to ensure one individual dose of vaccine reaches a child. Cold Trace helps make sure that that vaccine is safe. In the future, what I see is Cold Trace and other technologies like Cold Trace scaling up in every country, so that as a sector, we are all confident that every single vaccine administered to a child is protecting kids the way that they're supposed to.
Representing NextLeaf Analytics Cold Trace, Nitya Ramanathan.
Hello, everybody. On behalf of the entire team at NextLeaf Analytics and the hundreds of nurses that use Cold Trace every day to keep vaccines safe, we extend our deepest appreciation for being included in such an incredible group of laureates. Thank you so much. We connected with vaccine experts and nurses and doctors and really listened to what they were saying and built Cold Trace. After that, we iterated time and time and time again until we were able to develop a device that is now robust, useful, and ready to scale. In the coming year, Cold Trace will be scaled to 1/3 of all health facilities in India with the government. That means that we'll be protecting vaccines for 7 million babies every year. But there's vaccine cold chain in every country. And with this award, this will allow us to scale up our distribution and operations in new countries. And we're so grateful for that. Thank you so much to Sutter Health and the Tech Awards for this incredible opportunity. Every year, 100 million babies get vaccinated. And we believe that every one of them deserves a safe vaccine. Thank you so much for helping us make this ambitious goal possible.
Now it's my pleasure to introduce the second Sutter Health Award winner.
If you want to make a man feel really uncomfortable, talk to him about circumcising his penis. I should know. It's what I do every day. I work as an advocate for prepegs, which is a non-surgical method of circumcision. My job is to recruit uncircumcised men from the street to come and do prepegs. I'm going to be telling you about a new non-surgical method of getting circumcised. We have a new way of circumcision. It's called prepegs. There's no blood, there's no stitches, no injection, very little or no pain, and it's absolutely free. When I tell them at first I'm recruiting for circumcision, they're like, no, we don't want circumcision. I don't want to get circumcised. It's painful. It takes too long to heal. But then I tell them, no, this one is different. Prepegs is so much better. I explain to them how it actually works, and then they're fascinated. Well, this inner ring goes inside the foreskin. On top of the foreskin, they're going to attach this elastic band like this. This elastic band will stop the blood from circulating to the foreskin. You're going to stay with it for 7 days. You're going to go to work as per normal with this thing on. Then be able to urinate. Yes, you'll be able to urinate. You'll be able to walk properly, to work. On the 7th day, we're going to fetch you with our transport and take you to the clinic. Now it's time for removal. After removing the entire foreskin, we're gonna put a dressing around it. That's gonna last for 2 days on. After that, it's going to start healing. You can trust me, my brother. I've done it myself. Let me see. Protein contains cells that are very susceptible to HIV, STDs, and viruses leading to cancer. Male circumcision helps reduce the chances of contracting HIV by 60%. 1 in 5 South African adult men are living with HIV. I've seen friends and family die from this disease, including my late uncle, who passed away last year from AIDS. Sometimes we bring the procedure to the clients using mobile clinics. We have entertainers like dancers and singers to attract the crowd. What I like the most about working for Prepex is that I'm helping contribute to my community to help reduce the infections of HIV and AIDS.
Representing Prepex, Eddie Horowitz.
Wow. Good evening. This is really exciting. When the founders of CircMedTech developed Prepex, they never expected it to be recognized here tonight, 6 years later. We are so honored and humbled by this award, and in their name, I thank you. I want to thank our partners, the courageous government, leaders, and NGOs in Africa, our shareholders, and of course, the loyal and passionate Prepex team. I want to thank the Tech Museum, Sutter Health, and the judges for supporting our cause. And of course, I want to thank Sabelo, the guy from the movie, and the over 100,000 men who have chosen Prepex. We have decided to contribute the award we have received here tonight to their future by investing in HIV prevention activities in Africa. Together, together we can create an AIDS-free world. Thank you.